Go.
Hi.
Hi, good afternoon. My name is Summer. I'm a first year um, nursing student. I was hoping you give me SBAR on your patient.
Yeah. We're taking care of Marta Yarn. She's an 80-year-old female in room 529. She's full code with no known allergies. She was admitted today with a chief complaint of a sacral ulcer that she's had for 3 months. She was previously treated and there was no success. She has a history of pneumonia and dehydration. Um, the patient denies smoking and has no history of other chronic illnesses. Her last assessment revealed the BP was 144 over 90, respirations were 24, pulse 88, O2 was 92, and temp is 99.1. She has a standing order for IV morphine and oxycodone. She has also an antibiotic order for the gentamicin, and she also, um, we're going to run fluids on her, the normal saline as well. She's NPO after midnight due to the surgery that's tomorrow. We want to turn the patient every 2 hours and assess her vitals every 4 hours. And we also want to clean the wound with normal saline. And we're also waiting for a chest x-ray and the EKG results. She has foreskin turgor, and then she has that non-healing ulcer on her sacrum. Her respirations are clear to auscultation, and her chest expansion is symmetrical. She has bowel sounds active in all 4 quadrants, non-descended and non-tender. She has normal sinus rhythm. She has a slow gait. She's a walker, and she complains about lower back pain. And then there's no other issues noted.
Okay, gotcha. And why is she receiving the antibiotics and the fluids today?
She's receiving it because she has increased white blood cells, and she also has that ulcer on her sacrum.
Okay, and how does what action does the medication have on the body?
It inhibits the bacterial protein synthesis, so it's going to kill off the bacteria.
Okay. When would you question administering the medication?
You would question it in a patient that has impaired renal function or a dehydrated patient.
Okay. And which vital signs would be monitored? And what are the parameters that you're monitoring when the medication's being administered?
You want to definitely monitor their intake and output, and you also want to assess for edema, and you want to assess for dehydration, and any kind of hearing impairments or dizziness or diarrhea.
Okay. What interventions must be taught to the client to ensure the medication is safely administered in the hospital setting?
Really, you just want to make sure that the patient knows to report any signs and symptoms of dizziness, diarrhea, stomach pains.
Okay. And then what would you teach them for taking it at home?
They wouldn't be on this IV fluid at home.
Okay, gotcha. What are the side effects or the potential adverse reactions?
The nephrotoxicity, increased white blood cell, decreased creatinine, proteinuria.
Okay. And how will you know that the medication is effective?
You'll know it's effective if the white blood cells are within normal limits or if and the bacterial growth is inhibited.
Okay, gotcha.
All right, we're going to go in the room now and hook them up to the IV.
Hello.
Hi, how are you?
Good, how are you?
Good, my name's Jamie. I'll be your nurse today. Can you tell me your name and date of birth?
Sure, it's Marta Yarn, and I'm 80 years old.
Okay, do you have any allergies?
No.
All right, I'm just going to scan your wristband into the computer. All right, and now we have an order for normal saline and the gentamicin antibiotic. I'm going to, on the computer, there's going to be in the MAR, there'll be a green light next to each medication that's need to be given at this time.
Oh, okay.
So basically you just scan it in and it'll tell you if you have the right medication. So we're going to check the medication against the MAR. You're going to make sure you have the right time, the right route, the right amount, the right medication, and the right patient. You also want to check for any tears, holes, clarity, and the expiration date. I'm going to check this one against the MAR as well. So we're gonna first hang the primary bag of the normal saline. Make sure the clamp is closed. We're gonna spike the bag. Then we're going to prime the tubing. Alright. Clamp that. Now I'm going to hang the piggyback of the antibiotics. Make sure it's clamped and spike it. Hang that. Prime the tubing. Alright. And now I'm going to connect this. Alright. Then before I hook up the piggyback, I'm going to alcohol swab the port. Alright. And then before I hook up the IV to my patient, just going to hang that for a second, I'm going to flush her IV site. I'm going to inspect it for any redness, swelling, tenderness. Looks pretty normal to me. Alcohol swab the port of the IV flush. We're going to be setting this at 100 milliliters. Can you come and verify that for me?
100?
Yep.
Yep.
Alright. And then I'm going to open the clamps and let this run. We're doing 80 milliliters per hour for the piggyback, and then we're going to do 100 for the primary. I'm going to put her call light in reach, her bedside tray near her bed, and lower the bed as well. Do you have any questions for me? Yeah. Okay. And I'm going to come check on you, but just make sure if you have any symptoms of like diarrhea or stomach pains, or if you feel dizzy or anything, to press your call light.
Diarrhea? Okay.
Yes. Wash my hands. All right. And now we are leaving the room.
Okay. Were there any pertinent pieces of information you reviewed before administering the client the medication?
I assessed her renal functions. I saw in her charts that that's within normal limits. I assessed her for dehydration. I also did the culture and sensitivity test to make sure that the antibiotic we were using is going to be able to treat the type of bacteria that she has. I also assessed her IV site for swelling, redness, or tenderness, and I verified that she has no allergies to the medication.
Okay. And did it affect your decision to administer the medication?
Yeah. If any of those things were abnormal, I wouldn't have administered it.
Okay. And did the information affect how you administered the medication?
Yeah. Based on the information I gathered, everything was in normal limits, so it was safe to administer.
Okay, gotcha.
Okay. Anything else? All right.
I'm all set.